Asthma is largely an inflammatory disease of the airways. So patients suffer ongoing inflammation in their airways, and they get episodic instances where the airways start contracting in response to that inflammation. It's often if they have a viral infection or they come into contact with some sort of allergen, maybe pollution or pollen and that sort of thing. There's a small percentage, relatively small, about 8 to 10% of patients that have really, really severe asthma that doesn't respond to a lot of the treatments that we currently have in our arsenal of treatments. And so largely the general population think, oh, it's asthma, they can take an inhaler, but 8 to 10% of people just don't respond to their inhaler. So I really wanted to have an impact on those people and see if we can learn more about the disease and help the development of new drugs. What's become really evident, and has been evident for decades, is that patients with asthma have quite dramatic structural changes in their lungs. But for a long time we thought that was driven by the inflammation. That actually it might be driven, at least in part, by that closure of the airways. So when the smooth muscle layer that surrounds the airways contracts and closes the airways off, that might be causing structural changes. What they can do is they make the airways really, really stiff, and that impacts lung function. So patients, even when they're not having an asthma attack, even when their airways aren't closing, the airways are stiffer and it's more difficult for the air to pass in and out of the airways. So they have a reduced lung function. The fellowship funded me to develop a way of stretching the lung tissue in a model that more closely mimics what our lungs are doing, i.e. they're stretching and relaxing. We can model different rates of breathing. So for example, children breathe at a much faster rate than adults, so we can adjust how much the lung tissue is breathing based on the system that we're trying to test. I've used the findings from the fellowship to also start collaborating with a mathematician who has developed a mathematical model of the things that I study in the lab. So she's incorporated she's developed a mathematical model that simulates the breathing lung slice, and we're working together to really fine-tune that model so that essentially she could test many more things, validate it in my model, and we could test hypotheses that perhaps aren't currently testable. I think it's given us a lot more information about how our lungs respond to normal breathing and how that might be changed in disease, and that will really shed a lot of light on future drug development. I think if we can develop new drugs that target airway remodeling that could be used alongside anti-inflammatories, for example, we'd also have a sort of a two-pronged approach at tackling the disease.